Hi, everybody. This is Dr. Stephanie, your double board certified critical care physician who works with physicians that are struggling with their jobs, burnt out with their careers, or who just want some career advice. Through my books, webinars, coaching, and speaking, I help physicians discover alternative jobs and careers in medicine so that they can practice medicine on their own terms. I am back in Houston, Texas, and as you all know, we are recovering from Hurricane Harvey. And I would just like to take this moment to let all of my fellow Houstonians and everybody in Southeast Texas who has been affected by the storm to let you know you are in my thoughts and prayers, and also to let those people who have been impacted by Hurricane Irma and are in the path of Hurricane Irma to let you know that I am thinking about you all as well. I just wanted to take this time to talk to you about what it means to work as a locums doctor during a disaster. So I was away on a locums assignment in Illinois when Hurricane Harvey hit. So I was fortunate enough that I was not here during the actual storm. And my locums company was actually able to fly me from Illinois to Alabama because, of course, as you know, both of the airports into Houston were closed during that time. So I was in Alabama for a while, and then I was able to come back to Houston this week. So I've spent the last week or so just getting back into the swing of things. And fortunately, my house was not flooded. I'm grateful to God for that. But my car was parked at Hobby Airport, so my car is a total loss. So, one of the things that I wanted to talk about, like I said, is what it means to do locums during a disaster, because I have some friends who are locums doctors who have been impacted by, Hurricane Harvey. And of course, Hurricane Irma is impacting, our friends and family in the Virgin Islands and in Florida. So a couple of things I want to talk to you guys about. Sometimes it takes a disaster to make us reevaluate our priorities. We've heard countless stories about healthcare providers, physicians, doctors, and nurses, EMS people, all healthcare workers having to go to work and being at work for days at a time. And although this is what we're called to do, to put the needs of our patients first, sometimes that becomes a problem when you have a family. And so many physicians had to work, got trapped at work for days at a time, and they did what they needed to do to take care of patients while at the same time wondering whether or not their family was safe. And if you work for an organization that puts the safety of their employees first and foremost, if you work for an organization that really let you know that they appreciated the sacrifices that you all made or are going to make during these times, then that's a good thing. But I'm hearing from more and more physicians that they felt as though their organizations did not value their safety, did not care about the fact that it was life-threatening to get to work. They did not care about the fact that they were having to work in unsafe facilities, and didn't care about the fact that they left their children at home to come to work. So, disasters like these really allow us to sit back and think about what is really important. And if you're in a situation that you are not happy with, you are working at a job that does not value you or appreciate you, and if you've been thinking that it may be time to make a change, then you're probably right. And this may be the thing that you need to do in order to make a change. Because at the end of the day, the most important thing is your family and your life and your safety. And if you don't feel that those situations were valued by your employer, it may be time for you to start looking for something else. So what I ended up having to do as a locums doctor during this time, I actually looked at this time as an opportunity to start picking up some additional shifts, because I was out of town and I was out of state when this hurricane hit. And for a while, I had no idea the condition of my home. Several homes in my neighborhood flooded. I had no idea about the condition of my home, but I did know that my car flooded. And so I am faced with these unexpected expenses, and I don't know how much money I'm going to have to come out of pocket for. I didn't know, what the condition of my car is going to be like. I didn't know what the condition of my house is going to be like. So I looked at this as an opportunity. I said, you know what? I'm faced with some unexpected expenses. And because I work as a locums doctor, I was able to see about picking up some additional shifts. So my recruiters reached out to me and said, hey, Dr. Stephanie, is there anything you need? We're checking on you to see if you're safe. We know you live in Houston. And when I figured out that my car was a total loss, I was like, you know what? I'm having an unexpected expense of having to purchase a new car when I did not have a car note in my budget because my car was paid for. So I was like, hey, find me some additional work. Because like I said, I had no idea what my damages were going to be at my home, my car. I just didn't know. So I looked at this as an opportunity, and in looking at this as an opportunity to pick up some additional work. I know several physicians who have people living with them, and they are faced with the burden of housing additional people. And with that comes higher utilities, higher food bill, everything goes up when you have extended house guests. So, your expenses are going to go up during this time. I know physicians who have lost everything, lost their house, lost their car, and are not able to get to work because they're displaced, they have no car, and oftentimes their jobs aren't open. So when you work as a locums doctor and you work during a time of a disaster, this may be a good opportunity for you to pick up some additional shifts in order to cover some unexpected expenses, because you just never know what things are going to be like. So that's what I have taken this as an opportunity to do. I called my recruiters. I said, hey, find me some extra work. So that's what I did. And the other thing that you need to take this time and do as a locums doctor is you need to take this time to diversify your assignments, because you don't want your income being tied to one location or to one city. In Houston, some of the hospitals are still not up at capacity. And I read an article that stated that outpatient services are going to be impacted for a long time. So if you are a physician that is in one of these organizations and the organization is not running at full capacity, you your income may suffer because your patient volume may be low. You may not be doing the number of elective procedures that you're used to getting. So these kind of things can impact your income, can impact your revenue. Even if you work as a locums doctor, if you're working at a facility that's not open because it has been impacted by the disaster, you're not going to get paid. So, and then I know docs in private practice whose offices were flooded and they can't see patients. So when you work as a locums doctor, you need to look at this as an opportunity to diversify your locums assignment. I told a friend of mine who was in this situation, the clinic that he works in is not opening. He's a locums doctor. If he doesn't work, he doesn't get paid. And I said, hey, do you have some out-of-state licenses? If you have some out-of-state medical licenses, this is the opportunity for you to start looking for some out-of-state assignments, because you need to keep working and you don't need to have your source of income tied to one location. So that's what I recommend as well. And as you guys know, I do locums out of state. So my assignments are going to continue. And so I'm going to continue to be able to bring in the revenue that I need because I'm not working here in Houston. Now, it would be different if I were working, if I had locums assignments in, let's say, Florida or in the U.S. Virgin Islands. They're being evacuated. They're being impacted by Hurricane Irma. So that would be a problem if that's what I do. But I work throughout the country. So I work throughout the course of a month, I might be anywhere from West Virginia to Illinois to East Texas to Southern Texas. And that is one of the things that I've been able to do that has been able to keep me working on a regular and consistent basis. And it is important that during times of disasters that you continue to work on a regular and consistent basis, because you just don't know what kind of unexpected expenses are going to pop up. You don't know whether one assignment is going to cancel due to weather or any of those things. So this is a great opportunity for my locums doctors to really sit and think, what would happen if the city you work in is impacted by a major disaster and you can't get to work, or your hospital closes, or your clinic closes, or your office is impacted? What would happen if, as a locums doctor, one of the assignments that you have is in a hurricane zone, or one of the assignments that you have is in at a place that gets impacted by a winter storm and you can't get to work for that assignment? You know, what happens if your source of income is tied to a particular organization, or to a particular hospital, or particular clinic, or a particular city? So that's why it's important as a locums doctor that you diversify your locums assignments, and which is what I have been doing. So hopefully, you know, for those of you who are doing locums, and you know, take this as an opportunity to really kind of reevaluate some things. If you've been impacted in any way by these hurricanes, or you're in the process of trying to get back on your feet, you know, here are some of the steps that you can take. Like I said, work some additional shifts to cover for some unexpected expenses. Use this as an opportunity to diversify your locums assignments. Line some things up out of town, out of state, on the other side of the country. Line some things up. And this is just a good opportunity for all of us physicians, to reevaluate our priorities, because in times of crisis, we start realizing who is important to us and what is important to us. And the main thing that is important is our safety, our health, and our family, and everything else is secondary. And I do want to reiterate the fact I am continuing to pray for everybody in Southeast Texas, Houston, Southeast Texas, everybody that's in the storm, in the path of Hurricane Irma. You know, take care of yourself and be safe. For those of you who are interested in doing locums, download your free copy of my locums ebook at bit.ly, Dr. Stephanie Locums ebook. Thank you for joining me, and we will talk soon. Bye-bye.